Other causes of cardiac compromise include heart failure. When the heart no longer has the ability to adequately eject blood out of the ventricle, it is considered to be failing. The heart failure may be a result of a heart attack that affected a large portion of muscle because when the heart muscle dies, it no longer contributes to the pumping function of the heart. Heart failure may also be caused by a valve disorder, hypertension, pulmonary embolism, cardiac rhythm disturbances, and certain drugs. Pathophysiology of heart failure. Heart failure can be categorized as left ventricle failure or right ventricle failure. The consequences of left or right ventricular failure, the consequences of left or right ventricular failure can be understood by recalling the functions of two sides of the heart. And what are those two? You already know. The left side does what? The right side does what? Come on, say it. Say it. Shut up, you're wrong. Like I was saying, the left side of the heart receives oxygenated blood from the lungs and sends it out to the body's arteries, while the right side of the heart receives deoxygenated blood from the body's veins and sends it to the lungs to pick up oxygen. You got it? All right. Right side, deoxygenated blood. Left side, oxygenated blood. The left ventricular failure occurs when the left ventricle cannot pump blood out of the left ventricle effectively. This reduces blood flow to the arteries and the perfusion of blood to the cells throughout the body. Furthermore, blood waiting to enter the left ventricle from the left atrium and blood waiting to enter the left atrium from the lungs backs up in a sort of traffic jam. You got that? Huh? Furthermore, blood waiting to enter the left ventricle from the left atrium and blood waiting to enter the left atrium from the lungs backs up in a sort of traffic jam. All right? When the left ventricle fails to eject the normal amount of blood with each contraction, the blood pressure begins to build up in the left atrium. The increase in pressure in the left atrium, in turn, causes an increase in pressure in the pulmonary veins. It's just pushing back at that point, which are responsible for delivering blood from the lungs to the heart. The increase in pressure in the pulmonary veins creates a higher pressure in the capillaries in the lungs. It's just backing up, and everybody's being affected by it. Remember that the capillaries in the lungs are the sites of gas exchange with the alveoli. So once it gets to that point, to the capillaries, it's like, oh shit, all right? So once it gets to the capillaries, that gas exchange can't take place no more, right? Right. So, and the capillaries are, I'm going ahead of myself, but anyway, let me keep reading. When the pressure in the capillaries is increased, fluid begins to leak out between the capillary and the alveoli. That's what I was just about to say. The fluid collects between the capillary and around the alveoli and distal bronchioles. This causes the space between the capillary and the alveoli to do what? Widen, all right? Making gas exchange more difficult. The poor gas exchange leads to, your buddy, hypoxia. This condition is referred to as pulmonary edema. But you knew that already. If you knew better, you do better. I got 2 words for you, bitch. New sweater. Anyway, when the right side of the heart fails, the blood backs up into the venous system. The right side of the heart may fail due to failure of the left ventricle. It may also fail due to hypertension, high blood pressure. Oh, yeah, that's what hypertension is. Anyway, chronic obstructive pulmonary disease, COPD, may increase the pressure in the pulmonary vessels in the lungs and cause the right ventricle to work much harder. Over time, this may cause the right ventricle to fail. All right? And signs include peripheral edema, swelling, jugular vein distension, JVD, and liver enlargement. Another problem that can occur with left or right heart failure is a condition known as cardiogenic shock. But you knew that already. If you knew better, you do better. I got 2 words for you. New sweater. Made me lose my spot. This is a clinical state, not a diagnosis. Cardiogenic shock is a clinical state, not a diagnosis. Okay, we know that. In which the left or right ventricle fails to pump out enough blood to meet the demands of the body. The most common cause for this is myocardial damage that occurs secondary to a heart attack. Other less common reasons include sustained hypertension, valve damage, extremes in heart rate, too fast or too slow, and other cardiac muscle diseases, cardiomyopathies. Cardiogenic shock can be from the pumping inadequacy of either the left or right ventricle. When the left ventricle fails, the cardiac output drops, and there is a diminishment in the perfusion pressure to the rest of the body's organ. When the left ventricle fails, the cardiac output drops, and there's a diminishment in the perfusion pressure to the rest of the body's organs. Why? Because you need oxygenated blood for perfusion. All right. Common findings include a drop in systolic blood pressure, to include frank hypotension, diminished or absent peripheral pulse amplitude, altered mental status, changes in the heart rate, poor urinary output, respiratory distress, inspiratory rails, and possible pulmonary edema. The right ventricle can also fail for any of the same reasons as the left, but has slightly different presentation. Remember that the right ventricle pumps what? Blood to the lungs for reoxygenation. If the right-sided cardiac output starts to drop, then the lungs may be hypoperfused, which can lead to hypoxia and respiratory distress. Also, as the blood starts to accumulate in the ventricle from poor ejection, it will eventually back up into the atrium and subsequently into the vena cava. Findings of this may include jugular venous distension, or JVD as we know it, and peripheral edema. One other change in normal physiology is that if the right side is pumping inadequately, then the left side of the heart will receive an insufficient amount of blood. Since the left ventricle can only pump as much blood as it receives, the patient may also display many of the aforementioned findings of poor peripheral perfusion. It's a tongue twister. Poor peripheral perfusion, suffering succotash. There is, however, a triad of findings that may help delineate pure left heart failure from pure right heart failure. They are identified in Table 17-1, but we ain't reading it. Congestive heart failure, CHF, is a medical diagnosis that refers to the condition in which there is a buildup of fluid or congestion in the body resulting from the pump failure of the heart. In essence, it represents the condition where the left, the right, or both ventricles are failing to meet the body's needs. Oh, key right there. Congestive heart failure represents the condition where the left and the right, the left, the right, or both, all right? It can be left, right, or both ventricles are failing to meet the body's needs. It may be a chronic condition that presents over a period of time, or it may be more acute, as associated with a large heart attack that affects the left ventricle. Congestive heart failure commonly leads to pulmonary edema and edema, swelling, in other areas of the body. The edema will often be seen in the feet, of course, we know that, and ankles, the hands, and the presacral area, or lower lumbar region, of the supine patient. The fluid may also accumulate in the liver, causing it to enlarge, and also in the abdomen. When fluid collects in the abdomen may become distended and feel like a sponge. Often, these patients will sit upright and dangle their legs, feet, arms, and hands so that the blood can pool in the extremities and lessen the amount the heart has to pump out. And that, folks, is a cause of cardiac compromise, heart failure, the pathophysiology of heart failure. Break it down.